you?
Hi, good and you?
Good, thank you. I'm going to sanitize my hands before starting. Okay, so my name is Lisbeth. I'm here to examine you. Is that fine with you?
Yeah, it's okay.
Okay, so what is your name
My name is Ana Montiel.
and your date of birth?
It's September the 18th of 2000.
Okay, so this examination is just between us. There is no one in the room. There will be privacy with the information you will provide, so feel safe. So the purpose of this assessment is to determine your general status of health and also to create a nursing care plan for you. So do you have any allergy?
No,
Food allergy?
no,
Environmental allergy?
no,
Okay, perfect. Do you have pain right now?
no.
Do you feel nervous?
Yes.
Don't worry, there is no need to be nervous.
Thank you.
Do you take any medication?
No.
When was the last time you eat?
About an hour ago.
Okay. Do you have a headache right now?
No.
Okay, perfect. Where are we now?
At my house.
And when did you born?
I was born in September the 18th of 2000.
And what are we going to do today?
We are going to do a physical assessment.
Okay, so patient is conscious and hygiene is clean. She has no uncommon errors and she is 20 years old and she appears of a 20-year-old girl. So now we're going to take the pulse. Okay, can you please put your hand like this? Okay. Okay, so the patient had 65 beats per minute, and I also took the respiration without she noticing because then she will alter her breathing. So she got 12 breaths per minute. Okay, so now I'm going to take your blood pressure. Okay. So first of all, I'm going to hear to the radio pulses and I'm going to inflate. When I no longer hear to the radio pulses, I will stop. Okay. Okay, so it's stopped at 110. I'm going to add 30 to it and I'm going to let the patient rest for 1 minute to take it. Okay, so in the meanwhile of the 30 seconds, I'm going to clean the stethoscope so then we can take your blood pressure. Okay, so now that a minute passed by, we're going to take the blood pressure. First to feel the brachial pulse. Okay. And then we can start now. Okay, so it was 110/75, so it's a normal blood pressure. Okay, so I'm going to assess your skin, hair, and nails. Is that okay with you?
Yes, it's okay.
Okay, do you have any lesion?
No.
Do you have any moles?
No.
Do you have any patches in your skin?
No.
Have you ever had any changes in your skin color?
No.
Okay, perfect. So, color is according to ethnicity. Texture is smooth. Now I'm going to check your temperature. Can I touch your foot?
¿Se me sienta?
Okay. in your hands. Okay, so temperature is normal within the body. So we're going to check the skin trigger. So thickness and elasticity is regular. Now I'm going to touch you a little bit. Can you please do not cross your legs? Thank you. Do you feel any tenderness?
No.
No? Okay, so now we are going to assess your hair. Okay, so hair distribution is regular. There are no signs of alopecia and there is no pediculosis. Okay, now we're going to assess your nails. Okay, so cuticle looks fine without lesions. So capillary refill is less than 3 seconds. Can you please put your index fingers, the nails bed together? Okay, so apparently it's less than 160 degrees, so it's fine. Okay, now I'm going to assess your eyes, ears, nose, mouth, and throat. Okay, so do you have any vision problems?
I use glasses.
Do you have problem with far or near distances?
Far.
Okay, so I'm going to take a look at your eyelids. Can you close your eyes? Okay, so there are no lesions in the eyelids and there is no inflammation. Okay, so pupils are the same size, are round, and they have the same reaction to light, they get smaller. Okay, so the iris color is brown. So now let's take a look at the conjunctiva. Okay, so it's normal. It's reddish with pink. Okay, so right now you're going to follow the pen just with your eyes, not with your head.
Okay.
Okay, so it seems to be that it has a smooth movement of eyes. Do you have hearing problems?
No.
No. Okay, I'm going to take a look at your earrings. Okay, now the other one. Okay, so ears look symmetrical. Now I'm going to take a look on the inside. Okay, perfect. Now the other one. Okay, it looks a little bit of earwax, but nothing than normal. Do you have any respiratory infection
No.
or any sinus problem?
No.
Okay, now we're going to assess your nose and your sinuses. Do you have any problem with your sense of smell?
No.
Okay, I'm going to take a look at your nose. Okay. Okay, so mucous membrane are normal. They look with no lesions. Okay, now I'm going to take a look at your sinuses. Let me know if you feel pain.
Okay.
Do you feel pain?
No.
Okay, so sinuses are normal. There is no problem in there. Do you have any problem with your sense of taste?
No.
Okay, can you open your mouth, please? Can you say ah? Okay, so the tonsils are midline, are level +1. There are 0 to 25 to midline, so they are good. And apparently there is no lesions in the mouth. It is apparently without any lesion. Can you take your tongue out, please? Okay. Now can you do it up? Okay, thank you. So there are no lesions in the tongue. Okay, now we're going to assess the temporomandibular joint. Can you open your mouth? Can you close it? Okay, so there are no crackles, everything is normal. Okay, so we're going to assess your range of motion. So if you could please move your head to one side, then to the other one, then like a turn. Do you feel any pain, any difficulty?
No.
So range of motion was intact, it is smooth, and there were no difficulties. So now can you swallow, please? Okay, so the thyroid isthmus is symmetrical. Then we're going to assess your trachea. Okay, so the trachea is symmetrical too. There is no deviation. So now we're going to assess your lymph nodes. The first one is the preauricular. Okay, so it's not palpable. Then the postauricular is not palpable too. Then the cervical. Then the posterior cervical. They're not palpable too. Then the superficial. It's not palpable too. The superclavicle. It's not palpable too. Then the occipital. Can you put your chin to chest? They're not palpable too. And then the submandibular. And lastly, the submental, which is this one. And it's not palpable too. So lymph nodes are okay. So now we're going to assess your respiratory system. Do you have any shortness of breath?
No.
Do you have frequent colds?
No.
No? Okay, so we're going to assess your lateral to PA radial. Can you put your tongue in your shoulder and then extend your hand and the middle finger? Okay, so again your tongue and then your middle finger. Okay, now can you turn your side, please? Okay, so can you let your tongue right here? You're going to put it right here, and then you can expand your hand. Do you feel your rib cage?
Yes.
Yes. Okay. The other side. Let's turn around. Okay. Can you please put your tongue right here, and then your middle finger? Do you feel your rib cage? Yes. Okay. Okay. So the thorax is a cone shape, is normal, and the ratio is 2:1, so it's symmetrical, and there is the same color throughout the body, including the chest, so it's normal.